This video will explain the main risk factors linked to heart health and identify which lifestyle changes can be made to reduce them. The aim of this video is to help you identify behaviours and lifestyles which have the biggest impact on your heart health and show you ways to reduce the risk of future heart problems. What do we mean by risk factors? Risk factors are conditions or habits that increase your risk of developing heart problems, like a heart attack or a stroke. Some of these you can control, and some you cannot. Risk factors that cannot be controlled include age. The older you are, the higher your risk of heart disease. Ethnicity. Some ethnic groups are more likely to develop heart disease. Family history. If your close family members had heart disease early in life, you are more likely to develop it too. Sex. Biological. Men generally have a higher risk at a younger age, but women's risk increases after menopause. Risk factors we can change are smoking, alcohol, diabetes, blood pressure, cholesterol, body weight, and stress. Physical activity is covered in a separate video. First, let's look at smoking and how this affects the heart. The chemicals in cigarettes make the walls of your arteries sticky. This causes fatty material to stick to the walls. The fatty material can begin to block your arteries and increase your risk of having a heart attack. Smoking can also affect your heart and blood vessels by making blood pressure too high, making your heart beat fast. There are many ways to stop smoking. Identify your triggers and habits which make you smoke and look for ways to avoid them. Nicotine replacement therapy. Access stop smoking services in your local area. Alcohol is not good for your heart as it can increase your blood pressure and can cause weight gain. If you choose to drink alcohol, try to keep it within safe limits. Guidelines advise no more than 14 units per week for both men and women. A single unit of alcohol is about half a pint of beer, a small glass of wine, or a single shot of spirits. Be careful, as there are some drinks which are more than 1 unit. For example, a pint of strong beer, lager, or cider is 3 units of alcohol, and a 250 milliliter glass of wine is 3 units. Here are some tips to help reduce your alcohol intake. Choose alcohol light or alcohol-free beer or wine. Have at least 2 to 3 alcohol-free days per week and swap alcohol drinks with soft drinks or water. Diabetes is a serious condition where the blood sugar levels are too high because the body can't use it properly. If not treated, it can lead to serious health problems. Poorly controlled diabetes can damage cells and organs, damage heart arteries, increase the thickness of blood, increase blood pressure. There are several ways you can help manage your diabetes. Keep to a healthy weight, increase physical activity, limit alcohol intake, follow a healthy, balanced diet, stop smoking, get regular health checks. Blood pressure is an important risk factor, as if it's too high, it can damage your heart and blood vessels. It is also a risk factor for stroke too. Symptoms of high blood pressure can include blurred vision, headaches, nosebleeds, shortness of breath. However, symptoms are rarely noticeable, so it is very important to check your blood pressure regularly. Your target blood pressure level should be a systolic reading of less than 130 mm Hg and a diastolic reading of less than 90 mm Hg. If yours is higher than this regularly, please speak to your GP. There are a number of ways to help control your blood pressure. These include taking blood pressure medications as prescribed, reducing salt intake less than 6 grams a day, stopping smoking, keeping a healthy weight, reducing alcohol, reducing stress, increasing physical activity. Cholesterol is a natural fatty substance in the blood. The liver makes it, and it's also found in some foods. It helps keep our body cells healthy. High levels of bad cholesterol can raise the risk of heart disease, stroke, and vascular dementia. It can lead to fatty deposits in your arteries, making it harder for blood to flow. There are a number of ways to help control your cholesterol. Take your cholesterol-lowering medication. Increase activity levels. Stop smoking. Reduce alcohol. Maintain healthy weight. Increase the amount of good cholesterol through the foods you eat. Discuss your cholesterol levels with your healthcare professional. Extra weight, especially around your tummy, increases your heart disease risk. Having a waist measurement of more than 94 centimetres, 37 inches, for a man, or 80 centimetres, 31.5 inches for a woman, is a risk for heart disease. Having a body mass index BMI above 25 also increases the risk of heart disease. Increased body weight can lead to increased blood pressure, increased cholesterol, increases the chances of developing diabetes. There are many ways to help control your body weight. Be physically active. Eat a healthy, well-balanced diet. Portion control. Keep hydrated. Stop unhealthy snacking. Manage stress levels. Get a good night's sleep. Reduce food high in sugar and fat. Stress is how our body reacts when we feel pressured or scared. There are two types. Good stress. This helps us stay focused and do better. Bad stress. This is when it feels too much to handle and can make us feel sick or tired. When we're stressed, our body releases a hormone called adrenaline to help us respond quickly. Stress and anxiety don't directly cause heart disease, but they are connected to unhealthy habits that can raise your risk of developing it. There are many ways to help manage stress. Think about ways you can deal with stress in the short and long term at home, at work, and in your relationships. It's how you manage stress through your behaviours that make the difference to your heart health. For practical ways to reduce stress, please watch our mental health and wellbeing video in this series. All videos have been developed by the North West Coast Cardiac Clinical Network and partners. Videos are available covering the following topics: adult basic life support, cardiovascular risk factors, coronary heart disease and how the heart works, healthy eating, mental health and well-being, physical activity and exercise, understanding your medicines. Videos are also available in the following languages: Arabic, British Sign Language, Cantonese, Polish, Romanian, Russian, Urdu.